Hi, welcome and thank you for joining us to learn about your injection procedure. You're watching this video because you have been referred for an ultrasound-guided platelet-rich plasma injection. This video will cover why this procedure is being performed, what to do prior to the procedure, what to expect during the procedure, how the procedure will be performed, what the risks of the procedure are, what to do after the procedure, when to expect recovery and pain relief. We encourage you to pause this video at any time to write down questions that you may have and discuss these questions with your physician and/or treatment team. Why is this procedure being performed? You have been referred for a treatment to an injury that is causing you pain and/or disability. This treatment is called Platelet Rich Plasma, otherwise known as PRP. In addition to a rehabilitation program, PRP treatment can facilitate healing and recovery. PRP, produced from your blood, contains many healing signals and when injected into a painful area can help facilitate healing and pain relief. We hope to use these healing properties with your personal PRP injection. What to do prior to the procedure? It is important to tell us if you are taking any medications or have any health conditions that may interfere with the healing process. Common interfering medications include ibuprofen, naproxen, meloxicam, and celecoxib. Common interfering conditions include immunocompromising conditions, low platelet count, cancer, rheumatologic conditions, and any medications to treat these conditions. It is important to inform your treatment team if you have taken these medications within 7 days of your injection. If you take a daily aspirin, it is okay to continue taking it as prescribed. Fasting is not required for this procedure, but it is recommended that you have a ride home to help ensure your safety. What to expect during the procedure? On the day of your procedure appointment, you will be asked to change into a gown and a registered nurse will perform a blood draw from your arm. After your blood draw, with the assistance of centrifuge technology, your blood will be transformed into PRP for your injection. How will the procedure be performed? The painful site will be cleaned and numbing medication will be injected around the area. After the area is numb, your personal PRP will then be injected under ultrasound guidance to ensure accurate, safe placement, followed by a Band-Aid placement at the site. What are the risks of the procedure? Because we are introducing a needle into the site of pain, there is a risk of bleeding. However, this risk is minimal given the use of ultrasound guidance. There is also a risk of infection. However, the risk is minimal given the use of sterile technique. The risk of additional injury during the procedure is minimal as our physicians are highly competent and experienced with ultrasound-guided injections. If you have any questions about the risks of the procedure, please ask the physician. What to do after the procedure? Increased pain at the site is common and related to the healing process. It is important that you refrain from overuse and try to rest the area for the next day. Avoid doing anything that would interfere with the local healing process, including taking medications such as ibuprofen, naproxen, meloxicam, celecoxib, and icing or cooling. If you do need to take pain medication, Tylenol is the best option as it will unlikely interfere with the local injection treatment. If you take a daily aspirin, it is okay to continue taking it as prescribed. It is important to keep the injection site clean. Showering is okay, but avoid submerging the site in freestanding water like pools and baths for approximately 24 hours. Always monitor for signs of infection which include drainage, redness, excess warmth, fevers, chills, and increased pain. In the event that you experience any of these symptoms, please seek medical care. When to expect recovery and pain relief. The healing process is a complex one and often takes months to complete under ideal conditions. After the post-procedure rest period, it is important to resume your rehabilitation program as directed by your treatment team. We hope this video provided a good overview of the procedure. In many patients, the procedure can lead to significant and long-lasting symptom relief. Although this is considered a very safe procedure in trained hands, it can infrequently be associated with risks as mentioned in the video. Please talk to your provider about any questions or concerns you might have. The information contained in this video represents the views and opinions of its creators. This video has been made available for informational and educational purposes only. All rights to this video are reserved.